Hey everyone, this is Heidi from Beds by George with another video to increase your knowledge of safety beds. Today we're going to talk about the differences in door function for rigid side beds. One of the most challenging engineering problems for safety beds is how to get in and out of the bed. The door has to be tall and strong, but also easy to open. It should stay out of the way for entry and exit. If you watch the video, What is a Safety Bed?, you'll recall one of the requirements of a safety bed is that the doors cannot be opened without caregiver assistance. So all safety beds have to lock, but should also unlock quickly and easily by the caregiver. Ideally, they would all have doors that are easy to operate. Unfortunately, as we will show, how the door operates can vary greatly from product to product, and that function affects both the caregiver and the patient. The slide-down style or guillotine style has been around for years. It keeps things compact and has the potential for easy operation. Easily locking and unlocking this style of door can be difficult. The sliding motion is also problematic because it doesn't move away from the sleep area, so anything leaning against the door, including the user, will still be in contact with the door as it goes up or down. It is also susceptible to blankets and hoses getting stuck and hindering the door operation. Unfortunately, several beds with this style of door have been deemed unsafe and outlawed by the Consumer Product Safety Commission after causing injuries and fatalities. A newer design is the flip-down style. This door is a simple but effective design. To open, it just swings downward and hangs against the side rail. When closed, it locks into the corner post. As long as the door hinges below the sleep surface of the mattress, it eliminates pinch points at the bottom of the door and minimizes entrapment. By hanging straight down, it is out of the way for exit and entry. The closing motion pushes everything into the sleep area, so it is unlikely blankets or other materials will hinder the door operation. The downside to this design is limited height because it can never be taller than the transfer height. A 19-inch transfer height can only have an 18-inch door, and so forth. For many situations, a taller door is required. The challenges increase as doors get taller. These doors need to be stronger because they are for larger, stronger patients who are also more active. That usually means they are also heavier. On a side note, it also affects the overall bed design because taller beds risk becoming top-heavy or unstable without structural changes to the base, posts, and locks. There are 4 basic forms that these doors can take. The first is basically a double slide style. The doors slide up and down within channels bored into the corner posts. This design has all the benefits of the first door system we described, as well as all the negatives with 2 additions. First, as the doors pass one another, a massive pinch risk can be created. The second reason is less obvious. Some people like the idea of this door because on some units, both doors do not have to be opened. The caregiver can leave the bottom door in place to reach inside the bed. While this may seem like a benefit, this creates potentially dangerous conditions. If the patient needs a tall door system, how can half a door be acceptable? The door should either be open or closed and not allow for a potential unsafe halfway option. If it's argued that halfway is a safe position to leave the door, then did the patient really need a tall door? If the answer is yes, then this system is totally unacceptable and dangerous. If the answer is no, then a series of questions arise about appropriate medical equipment, excessive restraint, or fraud. Insurance companies are not outside their rights to question if a shorter door system would have been adequate. Another style is a hybrid. In this design, there are also 2 independent doors. To open, the caregiver removes the top door and sets it aside. Then the bottom door is just a flip down like we've already discussed. The flip down advantages are apparent, but the top door removal is a hindrance. The most obvious problem is what do you do with a 6-foot-long door once it is removed? Lean it on the wall? The second problem is that high side beds are for active users. What is he doing while the caregiver is dealing with this door? Further, this also has the questionable half-open feature we discussed in the previous dual slide option. A taller door really needs to be either all the way open or all the way closed. The third style is a split door system. Whether the doors are bifold or solid, each door runs half the length of the bed and meets in the middle. The benefit of this design is the ability to have much taller doors without having to increase the transfer height. Also, it's possible on some designs to only open one door. The weakness of the design is exactly that, the weakness. It is very difficult to attain enough strength where the two doors come together. This seam is a potential weak spot, but this is also the area that requires the most strength because this is the area that takes the pressure when the user pushes or pulls on the door. As a general rule, the taller this style gets, the weaker the seam becomes. This is a problem because you'll remember that taller doors are for larger, stronger, more active users who need stronger door systems, not weaker. Additionally, this also has the potential halfway open door problem. A halfway open tall door system can be inefficient and unsafe. A better use of the bifold system is the Beds by George patent trademarked bifold door. This is a variation on the swing down door where everything moves away from the sleep area to remove pinch points and so forth. When open, the specially engineered hinge design allows the doors to hang flat and straight against the side of the bed. These doors are heavy, so there is a spring assist used to allow the user to easily open the door with one hand, leaving the other free to make sure that the patient remains in the bed. In one motion, the entire side of the bed is open. Not only that, but there are no pinch points on the inside of the door that could harm the patient. In this design, no strength is lost with the taller doors, and there's no risk of the open halfway problem that is present on the other tall door options. I hope you have enjoyed learning about the different door style options for safety beds. Hopefully this video has helped you better understand how door operation should affect your selection of a safety bed based on your needs. Keep on a lookout for our next video, and God bless.